This video is going to focus on the organs of the urinary system and the reproductive system. Here we see the two kidneys, the right and left kidney, and this right here is a urinary bladder. Urine is produced in the kidneys and stored in the urinary bladder. Between the kidneys and the urinary bladder are ureters, right ureter and left ureter, which are nothing more than tubes to allow urine to be transported from the kidneys to the bladder. Please keep in mind the kidneys are in the space known as the retroperitoneal space, as are the superior portion of the ureters. Bladder is in the pelvic cavity. If we look at this, from here down, this line down is going to represent the pelvic cavity. So we see the kidneys superior up here, and the top portion of the ureters as well are not in the pelvic cavity, but the inferior portion of the ureters are in the pelvic cavity, as is the urinary bladder. Found in the pelvic cavity are also the reproductive organs and certainly some of the intestines. What we see here is the rectum. Here is the uterus, fallopian tube, ovary, vagina, urinary bladder. This image right here is showing an anterior coronal section of the female reproductive organs, vagina, uterus, fallopian tube, also known as uterine tube, and also known as the oviduct. This curved region of the uterine tube is known as the infundibulum, and then we have the fimbriae at the distal end of the fallopian tubes that allow for the sweeping motion that propels the ovulated egg into the uterine tube. And once again, rectum, uterus, vagina, urinary bladder. This right here is the labia minora and labia majora. In males, rectum, anus, urinary bladder, testis, epididymis, vas deferens or ductus deferens. This is a prostate gland. These are the seminal vesicles, and this is a penile urethra. Keep in mind that the urethra in females is not part of the reproductive system, but it certainly is in males. Looking at this is looking at one testis. This is the epididymis right here, and what this is showing is the spermatic cord. Keep in mind, the male gonads are exterior to the body cavities, but the vas deferens or ductus deferens needs to travel up into the pelvic cavity, as do the testicular artery and testicular vein. So this is a spermatic cord that carries the vas deferens, otherwise known as the ductus deferens, the testicular vein, and the testicular artery. And certainly there's going to be nerves in there.